Hey everyone, welcome back. Dr. Forrester Dean.
Venzel here.
And Venzel is getting ready to start his program.
Yes.
Any minute. Very exciting. Physical therapy, right?
Yes.
Yeah, and you want to specialize in OT?
Yeah.
Yeah.
So for me, I love dealing with the upper body.
Yeah.
And then activities of daily living. That's literally like what dealing with my grandmother is one of the main reasons why I chose the career that I chose in the path. Is because I've always done it. So, why not help others as well?
And doesn't it seem like it happens a lot that way where it's either ourself, like for me, it's my low back, and I just really want to get back on the court, or it's a family member that kind of drives us into this business.
Yes.
So today is super casual. We definitely have a topic for you. It's, we want to keep things positive, but we're also going to talk about sort of our struggles, individual struggles as practitioners in maintaining this, professional relationship verbally and such with our practitioners.
Yes.
The people who take care of us or our loved ones, your grandmother.
Yes.
Right? And how there's this whole, I'm just going to say it's like a negative energy between the practitioners.
Yep.
Right? And we talked about this a little bit before we started, so kind of get the ball rolling. But, we each individually within the last few days have had just a struggle with maintaining our own professionalism, our own ethics, and our own values, right? To be professional, even just as casual people, even as a patient, to be a professional, right? But then there's this whole, like, are doctors really thinking they're God? Do they really honestly believe like they have all the answers and they're always right? Like, that just can't be real.
Yeah. Ego is a big thing that I feel gets in the way in medicine and the healthcare field. People go to school for, long periods of time, and they get locked into a certain set of, I'll say that set into the monotony of medicine. So,
it's highly structured.
Yes, highly structured.
With a lot of rules and boxes that keep them squeezed into thinking a certain way and acting a certain way and performing because there are so many layers of supervisors and managers and, shareholders and, all of that above them, where us as just people walking the earth, it's us and our loved one.
Yes.
There's no one above us telling us what to do.
And it makes it, like you were saying, the shareholders, the supervisors, it makes it less efficient. Now it becomes profit driven. And if you could have helped somebody in 14 visits, now they want it down to 8 visits. Now you're cutting down that timing.
Right. And less total people managing each patient's case. Yeah, so we're going to see what happens here. I have no problem. I've got a big story to tell. We're going to try to tell it in a little amount of time, which is kind of sometimes a struggle for us. And then, you've got a situation, we'll see how that evolves. But basically, what we're trying to message today to our audience and, to you folks as patients and even as clinicians is that there's a real reluctance to provide accessibility between, so I call it the patient-doctor relationship. Others, in the business would say, doctor-patient, but I think it's patient-doctor.
Yes.
Right? And we've talked about that before. But so, I mean, even I'm a doctor, and I just went to a very long-awaited 2 years waiting, right? And already I was declined twice. because I'm having issues with my legs that are pretty intense, you know, and I'm working on it on my side. But of course, why wouldn't I want to reach out to the medical community, probably now for the 14th time, to try to get some help, a diagnosis, something other than, I mean, so far all I've gotten is a tube of cream to put on my leg. That's all I've gotten. And a PT referral. I wish I could tell you her name because she's amazing and upcoming. She's young.
Yeah.
She's with UCLA. And we had a great little talk, and she's like, Mr. Dean, whatever, you're already way ahead of whatever we can offer you. So, you know, so that's a dead end. So what I'm looking for is a live end. I'm looking for a relationship with a professional who can actually kind of creativity and, you know, clinical and critical thinking.
Yes.
Right. And kind of like, hey, have you thought maybe it's, I don't know. I can't think of everything, right? I don't want to presume. And most doctors already don't self-treat or self-diagnose for very good reasons, right? But I've got insurance, so you have insurance, so why wouldn't we use it, right?
Yeah.
So I went, he already knows a little bit about this. So I went to this long-awaited sports medicine specialist consultation. And the main messaging I have here, it's actually 2 points. The first one is, I got nothing. I went in with hopes and you know, big like ideas. I was kind of excited about it, to be with a sports medicine pro. That didn't happen. And not only that, but I was shut down. I mean, I know, what do they say now? Canceled? Like,
yeah.
She canceled me. I'm the patient. And you want to know why? Because she felt threatened by my knowledge, maybe because it was, I don't know, like say above her, you know, out of her scope. But you already said it, that scope is already so tight. And there's only, you know, we learn every day. I make it a point to learn. Read, listen to TED Talks, look over my notes.
Teaching myself multiple languages.
Chinese, Vietnamese, and Spanish. Like, and why?
Because I want to be able to get this message out to as many people as possible.
Accessibility.
Yeah.
Already, and it hasn't even started his program. So I went in to the clinic, and this is what I thought was going to happen. I knew it was a female, and I'd waited a long time. Like I said, I was declined 2 times. I was like so excited, right? So I went in and I waited in the room. I actually did like some stretches. You know, I just kind of dug into my joints and kind of got a little amped up. You know, I did a little ankling, and you know, I was like, this is great. And then I looked around, and it's the gynecological exam room. So there were no bands, no weights, no Olympic station, no rubber floor, no open space, no artificial turf, like nothing. Nothing.
Oh, gosh.
So their sports medicine exam room has a gynecological exam chair in it and a couple of cabinets with gynecological supplies and speculums and rubber gloves and such. And then, you know, the monitor to keystroke in
your notes. Yeah.
I was like, okay, maybe I'm going to a different room. So I was like, still amped, right? This is what I thought. I thought she was going to be coming in on her shift, because it was first thing in the morning, off the tennis court, and she was going to be like lively and charged and on, and like, what's your sport? What are you about? What's holding you back? Right? And we were going to do all these direction change drills and, you know, high-low and hand-eye, you know, all this, like, the stuff we've already talked about over and over and over and over and over and over, right? Multi-directional, triplanar, all this stuff, right? Acceleration, deceleration, different energy systems, anaerobic, aerobic, right? Nothing. So she comes in the room, and I have to say she had an intern in there that was super great, young, super great, highly motivated, and she and I got on great. So she actually took my chart notes. So the doctor comes in, sees me, and basically does, okay, so I'm her. This is her, right?
Oh,
horrible posture. Just everything was just tragic. Dirty lab coat, shoes like 3 sizes too big, like swimming, like boats, like this, and greasy gray hair. And she looked at me up and down like this, and then she turned away, never made eye contact. Didn't reach out, shake my hand. Hey, how are you doing? Let's hit it. What's your sport? What's your troubles? Nothing. Just classical orthopedic exams. Can you touch your toes? Now, this is the point of today. And feel free to chime in.
Okay.
This is the point. The point is, why are you having me touch my toes? What does that say about my ability as an athlete with a problem with my legs?
Yeah.
And not even instructions. How do you want me? So she goes like this. Okay, so go ahead and touch your toes. So this is how she did it, right? So, I mean, she's obviously stuck in flexion, pelvic flexion. And I'm not here to be bad on her, but I'm just saying, if you can't demonstrate it, and then you don't understand or can't communicate the parameters of the exam, don't do it. And maybe just, and we already said why we're doing this. I wanted to say, maybe you should be working in a drugstore, like instant service as a doctor, but I didn't. But this is part of what our message today is. This, I was so angry and so disappointed and so brokenhearted that all I could see were all the shortcomings, and I didn't say anything directly to be competitive or disrespectful,
because you're trying to
get, but the emotions were there and the thoughts were there, and I wanted to say, how dare you ask me to touch my toes when it has nothing to do with tennis? Nothing.
Even that emotional, like we talked about before, about the emotionality to it. She already put you in a guarded state because of how she was interacting with you. It was very defensive, very brutish. And you're like, okay, already it's off-putting, so it's putting you in a guarded state. So even if she had a test that would give some type of result that was, meaningful, it's kind of slightly biased because of that guarding. Because we talked about it before.
You keep bringing that up.
It's literally
the patient can't come in like that.
No, it affects everything. It affects the way you diagnose. It affects the way you treat.
It affects me being tight.
Because I'm
irritated.
The diagnosis should also have the treatment built in with it as well. So once you get the diagnosis, the treatment, whatever you do in the diagnosis, the treatment should show what you did in the diagnosis.
Yeah, exactly.
So that in itself, putting you in that guarded state affects all of that.
Right.
So just from the emotionality alone, one of the key points that we talk about, she's already did a disservice to you as the patient.
Right. Compassion and empathy.
Not there.
Right. And so what was missing was her title and my expectations totally missed each other. So and I can say this, don't call yourself a sports medicine specialist if you're not. If you don't play a sport, at least one or more, or are regularly affiliated with athletics and sports, and understand movement patterns and faulty movement patterns, and understand how to examine triplanar acceleration to deceleration, gamma gain, all these things that we've talked about before, right? In a succinct, efficient, meaningful way, quickly, and encouraging your patient.
Yes.
By saying, hey, you know what we're going to do next? We're going to do a squat test. Now let me show it to you first. And I can learn a lot from the squat test. Maybe more than me showing you what's going on with your tennis. We're just going to start with the basics. Squat test has 10 parameters, 10 points that I'm looking for. I'm going to have you do 5 squats because this is standardized, right? Now there are versions of this, right?
Yes.
But it should be, you can't just squat up and down and that's it, right? But she didn't. She used the squat test to make me look bad. She was like, your legs hurt. You look like you're having an extension problem. I'm going to have you do an extension drill, and you're not going to be able to do it, and it's going to hurt, and I'm going to show you who's
why I'm
boss.
right. Yeah. Do no harm.
Never do harm. So I did it, but I wanted to say, but I didn't, because I needed to maintain my personal professionalism in the moment to not create a barrier or, create any unwillingness in the doctor
for her to
give me her wholehearted attention, which maybe she was, maybe she wasn't. I'm not going to say she did or didn't. I'm not her.
Yeah.
So I said, what kind of squat would you like? And she looked at me like I was stupid. And their arms overhead, like this genie style, arms reaching.
Yeah.
What kind of squat? Do you want my feet pointing out, forward, wide apart, close? So I said, oh, okay, sure. Now remember, she didn't demonstrate it to me, and I'm just guessing why.
Because she can do it herself.
Because she can't do it herself.
Yeah.
Right? So I just, it's like, cool. Like this?
No repetition count or anything?
No repetitions? No assessment? And I said, I'm pretty comfortable here. How long do I need to stay here like this? Nothing. Her intern, who's an MD, I could hear her when I went down. She was like, wow. I could hear her say it. Okay, now, first do no harm means don't ask a patient in pain to do a complex, and the squat is very complex.
Yeah.
Complicated, highly disciplined drill if you know it's going to hurt them, and if you know you're just doing it to show them like you're going to make them look bad.
Yeah.
So what happens when I go, oh, okay. And she's like, yeah, I understand. I got it now why you're having a problem, because you can't do a squat. So what if I'd faked it and done a bad squat? So she never praised my squat. She just was like, uh-huh. Okay, now I want you to touch your toes. It's like, do you want a round back? You want a flat back? Like what kind of... I mean, touching my toes has nothing really to do with tennis, but I guess I could do that.
Nice.
It was just like a moment by moment breaking me down to show me up, right? And then I was like, so I have these images of my MRI.
Mm-hmm.
And she said, well, I've got the report. And I said, except for the report is incomplete. And it's missing a lot of things, like it's not looking at, we talked about this before, fatty replacement.
Yes.
Or tonic, like toned, highly toned, like psoas. Remember we were looking at the psoas?
Yeah.
And mine are kind of fluffy and full, right? And the guy with the fatty replacement, they were like cords. They're like cables, steel cables, perfectly round. Well, I don't really read MRIs. I just rely on the report. And I said, oh, well, I can show you like 3 years ago and today, and I'm like 90% resolved. Well, how do you know? Do you have the report? I said, no, you just look at the picture. It's just then and now. Well, how do you know? Are you a licensed radiologist? And I said, yeah, better. I'm a chiropractor. So radiologists can only read and report, but they can't diagnose. They can only give impression.
Mm-hmm.
I can diagnose. Oh, well, the report's always been good enough for me. Except in my case, the report is incomplete, and I can think of at least 125 things that can't be seen on an MRI that can, and we've talked about this, that contribute to the problem. And yes, maybe you do see one thing, but how many other things are contributing in addition to that that aren't on the MRI?
Wow.
Venzel, my heart was broken. Number one, because I really was putting a lot of weight on getting something out of this transaction, out of this consult. And second,
because it's time, money.
Because this is one of my peers giving me a rash of shit. Trying to make me look bad.
Yeah.
And then when she finds out that I'm a chiropractor, it's the classic, what's that? What do they do? Right? And at the end, and we already talked about this, at the end of my appointment, I felt this huge responsibility to resurrect my relationship with this doctor by being overly polite, being overly apologetic, by making myself feel and look small. So I sat down on this little stool so that her head was higher than mine on purpose. And I said, what should we do next? I felt like I had to be able to kind of leave there with any kind of dignity, put her back up on her pedestal, put her in her godly place before we parted our ways. Because what if I need her again?
Yeah.
Or what if I need a referral and she jacks that up?
Yep.
I mean, are you hearing what I'm saying? Are you hearing this? I have to make the doctor feel better about themselves by apologizing for my knowledge and my situation. Wow.
That's a big problem because and it's the fact that it's the reality you had to deal with in the moment. So you having the foresight and the wisdom to know that you had to take her emotionality into play because she could hinder someone who possibly can help you, and she blocks that.
Right.
She tries to block that because she didn't like the way that you showed her up or the way you broke something down to her that she's never had broken down to her before. So for you to do that, one, I commend you. Two, it's sad that had to happen that way. And then three, that's something that obviously we have to realize that in the mainstream health in America right now, in the United States, we have to acquiesce to the doctor's whims. And that's not just you, that's all of us, because they dictate when they can see us, this or that.
How long they're going to see us.
Yes, is it in and out 15 minutes?
How much they're going to contribute.
Exactly.
So how guilty does she feel about mishandling my case? when I was there as a team player saying, in a way, hey, it's okay if you can't read the MRI. I can. That's a building block. That's not a barrier. That makes the doctor-patient relationship stronger.
Yeah.
Oh, you see a 90% improvement? I can't read MRIs. Hey, that's great news. Awesome. So we don't need to look in that direction anymore. Let's go in another direction. What else did you find out? Is there anything else? Because this is really helpful. It doesn't matter who comes up with the linkage.
Yeah.
Right? It's football and soccer, rugby. Those are team-based sports. It's not one
It's not subservient.
MVP.
Yeah.
And everybody else is just dead weight.
You can't
It's
get the
a
MVP
team.
without the team.
Right.
So even though a player was elected the most valuable player, any MVP, true MVP, would know they're nothing without their team.
Right.
You can't get an MVP without having a strong team. You can't carry the load by yourself because you can't play every position.
Right.
So your team has to do their job so you can shine and you can be that light out there.
So my doctor, who is super cool, my general practitioner, he sent me to this, tried to get me in 2 times and I got declined. And then third time he's like, I got you in, right? He's a team player.
Yeah.
He says to me all the time, Dean, I don't know what to do. Help me figure out what to do, and I'll create those orders for me. I'll move you in the right direction. But you have to promise me that you share what you find so that I'll learn and I'll know.
Yeah.
Right? So I was very disappointed, and the point of today is to kind of bring up some of those barriers, those,
shortcomings in this field.
Why it's almost not even worth asking, why can't medicine improve? Because it's the way it is.
Yeah.
So what we are attempting to do is to build the patient and the athlete's knowledge and the clinicians that have the flexibility, that aren't stuck under layers and layers and layers of administration and shareholders and all that. Clinicians with more flexibility that are interested and willing in growing their relationship in a stronger way, where actually the kind of things we share with each other, we're sharing with our audience.
Exactly.
Why? I mean, we've got hundreds and hundreds and hundreds of hours of us recording and editing and building the sets and having the ideas and creating the video list and all of that. And then we offer it all for free on YouTube because we care.
You know what? This is what I just thought. And this is a part of our messaging as well. It's passion in people, not profits over people. Passion in people, not profits over people.
Right.
That's
I like
literally, because when you were talking about the shareholders or not, it's profits over people. It's just sad reality. It's about how much can we get back this quarter. How can we increase this quarter? What can we cut back on administratively to bump up profit in its margin? And, it's not about truly helping people anymore. It's about making a buck versus what I just said was passion in people. You want to ignite a fire in every single one of your patients or clients, because that carries through the rest of their life. That's why our clients, they talk about what our messaging, what we talk about with the core neutral, gamma gain, talk about the fascia connect, the myofascial slings. they start to use this in their own verbiage, which means they're internalizing what we're giving to them.
Our vocabulary
Yes,
is kind
literally.
of catching on.
Yes, yeah.
Yeah.
Literally, it's growing because they see the methodology behind it and they see that it works. So if it didn't work, it wouldn't become a part of them.
And it's simple messaging.
Yes.
And it's simple concepts, one at a time, so that it's digestible and it's not overwhelming.
Exactly.
Yeah. So this was fun. It was a little bit of an adventure, and I hope people understand that we have the best intentions.
Yeah.
So today was mostly about our personal experiences.
Yeah.
Our sort of professional, personal perspective, where normally we're like the textbook is pretty deep.
Yeah.
And and so I hope this was helpful in letting you know that we are highly impassioned and very compassionate. Not only do we care, but we do something about it. We've invested an enormous amount of time and an enormous amount of money in scheduling to bring these messages. And stick with us. We have plenty more to share. Thanks so much for being with us today. I learned a new word this week in my yoga practice, so I'll share it. Dhanyavadaha. Dhanyavadaha. Thank you. See you next time.